One of the primary goals of all living creatures is to survive. To do so, cells must be able to reproduce. There are two means of reproducing: asexual and sexual reproduction. First reproduction allowed a species of cells to increase its population and subsequently have a higher competitive advantage. Second, sexual reproduction can help to introduce genetic variation into a species which can be beneficial in the long run. As no two individuals are same, so genetic characters from both parents will help make a slightly different copy of themselves. These small variations accumulate over hundreds of years, resulting in a formation of new species. Cells can reproduce in two ways: mitosis and meiosis. In mitosis, the resulting daughter cell is an identical clone of the original cell. Mitosis is mostly used by somatic cells, that is, cells of the body. Meiosis, however, is a form of sexual reproduction and only occurs in gametes, that is, reproductive cells. The resulting daughter cells have different genetic information than their parent cells. The purpose of meiosis is to increase the genetic variation. Reproduction is the process through which life continues to exist. So, both reproductive systems, whether male or female, are important for survival of life. Reproductive system in humans. The male reproductive system consists of the testis, epididymis, the accessory glands, that is the prostate gland, the seminal vesicles and the bulbourethral glands, and the ducts as well as the external genitalia. Sperm production takes place in the testis. The testes have a tough outer fibrous capsule that encloses masses of coiled seminiferous tubules clustered into 250 to 300 compartments. Between the tubules is interstitial tissue consisting primarily of blood vessels and testosterone producing Leydig cells or interstitial cells. The seminiferous epithelium consists of the germinal elements and the Sertoli cells. Interaction between these two cellular elements is important in the regulation of spermatogenesis. Sertoli cell morphology divides the seminiferous tubule in two compartments, a basal compartment and the other the adluminal compartment. Surrounding the outside of the tubule is a basement membrane. It acts as a barrier, preventing certain large molecules in the interstitial fluid from entering the tubule. The lateral branches of the adjacent Sertoli cells are linked to each other to form Sertoli-Sertoli tight junctions that form an additional barrier. Between the lumen of the tubule and the interstitial fluid outside the tubule, these tight junctions form a blood testis barrier, preventing movement of materials between the two compartments. Thus, the Sertoli cells play an important role not only in providing mechanical support for the germinal cells, but also provide a favorable environment for their differentiation. They are also involved in the secretion of fluid into the seminiferous tubule, which carries spermatozoa into the rete testis. Males produce sperm continuously from the time they reach reproductive maturity. Temperature control of testis. Sperm cells will not produce at core body temperature in most mammals. To adapt, the testes assume an external position. Testicular descent from the abdomen normally transpires during fetal or neonatal life. In other species, for example, rodents, the inguinal canals remain patent and the testes periodically descend or retract. This activity is coordinated in the wild with the mating season. In certain abnormal conditions, the testes fail to descend into the scrotum, and such individuals are said to have Cryptorchidism. In this condition, the testes are not functional and there is no spermatogenesis, because spermatogonia will eventually degenerate due to high temperature. Cryptorchidism does not have a major effect on testicular output of testosterone. Testicular descent is permanent in many mammals, for example, domesticated animals and primates. Scrotal temperature is a few degrees lower than the internal body temperature. Several compensatory mechanisms help in maintaining testicular temperature within defined limits. For efficient dissipation of heat, the scrotum lacks subcutaneous fat and is rich in sweat glands. A two-muscle system lowers and lifts the testes. The tunica dartos is a smooth muscle lining the scrotum. The cremaster muscle extends from the body wall through the inguinal canal surrounding the spermatic cord. Increase in temperature causes the muscle to relax. The spermatic cord extends and the testes are lowered from the body. Cold conditions cause contraction of the muscles, pulling the testes into the abdomen. Scrotal surface area contributing to loss of heat is decreased when skin of the scrotum becomes wrinkled due to contraction of the tunica dartos. The scrotum keeps the tissue 2 to 4 degrees cooler than the abdomen because of a complex heat exchange system known as pampiniform plexus. The heat exchange system is formed by network of arteries surrounded by a network of veins. Arteries and veins are coiled around each other, providing a large surface area of contact. Warm blood flowing through the spermatic artery is cooled by the cooler countervenous blood returning from the testes. This network was described by Sechel in 1977 as pampiniform plexus. Spermatogenesis. Spermatogenesis is the process of sperm cell development. Rounded, immature sperm cells undergo successive mitotic and meiotic divisions and a metamorphic change called spermiogenesis to produce spermatozoa. Spermatogonia divide by mitosis to produce more spermatogonia or differentiate into spermatocytes. Meiosis of each spermatocyte produces 4 haploid spermatids. This process takes over 3 weeks to complete. Spermatids undergo a dramatic change in form during spermiogenesis into the streamlined spermatozoa adapted for fertilization. Cells do not divide during spermiogenesis. Spermiogenesis involves a nuclear condensation, formation of the acrosomal cap, and development of a tail. Sperms lose most of their cytoplasm in the process. In general, one spermatogonium gives rise to 4 sperms. However, recent studies reveal that each spermatogonium can contribute 96 sperm cells as it has renewal capacity. Sperm cells are little more than flagellated nuclei. Each consists of a head which has an acrosome at its tip and contains a haploid set of chromosomes in a compact inactive state. A midpiece containing mitochondria and a single centriole, a tail which is a flagellum. An adult male manufactures over 100 million sperm cells each day. This gradually move into the epididymis where they undergo further maturation. In addition to making sperm, the testis is an endocrine gland. Its principal hormone, testosterone, is also involved in the production of sperm by the testis. It regulates body changes associated with sexual development, the growth spurt that occurs during puberty, and the appearance of other male secondary sex characteristics such as deepening of the voice, growth of facial and pubic hair, and the increase in muscle growth and strength. Structure and function of epididymis and accessory sex organs is dependent on testosterone. The accessory reproductive glands of the male reproductive tract consist of paired seminal vesicles, paired bulbourethral glands, and a single prostate gland. This structure are directly associated with male reproductive tract and produce numerous secretory products that mix with the sperm to form a fluid called semen. The seminal vesicles produce a thin yellowish viscous fluid. This fluid is rich in fructose. It also contains citrate, inositol, prostaglandins, and several proteins. Seminal vesicle secretion makes up to 70% of human ejaculate. Fructose produced by the seminal vesicles is the main carbohydrate of semen, which is metabolized by sperm and serves as the main energy source for sperm motility. Prostate gland produces a thin, watery, slightly acidic fluid that is rich in citric acid, acid phosphatase, and amylase. It also contains fibrinolysin and lipids. The enzyme fibrinolysin in the fluid liquefies the congealed semen after ejaculation. The prostate gland is the best known of the three accessory glands because of its medical significance. Cancer of the prostate is the second most common form of cancer in man. Benign prostatic hypertrophy creates problems for many men after age of 50 because the prostate gland completely encircles the urethra. Its enlargement causes difficult urination by narrowing the passageway. Bulbourethral glands produce a clear, viscid, mucus-like secretion that during stimulation is released and functions as a lubricant for the urethra. The secretory products from the seminal vesicles, prostate gland, and bulbourethral glands mix with sperm to form semen. Seminal plasma provides the sperm with a liquid transport medium as well as nutrients. It also neutralizes the acidity of male urethra and vaginal canal and activates the sperm after ejaculation. The external genitalia consist of the penis and the scrotum, a sac-like structure that contains testes. The urethra serves as a common passage for sperm and urine. Andropause. Men do not experience an abrupt decline in fertility and endocrine gonadal function. In human male, aging is accompanied by a gradual decrease in the plasma levels of testicular and adrenal androgens, focal atrophy of the seminiferous epithelium, and increased prostate growth. In Asia, there are more than 200 million men between the ages of 40 and 55 who are now going through so-called male menopause, also called a viropause or andropause. In less than 25 years, the number of men going through male menopause will grow to approximately 400 million in Asia. Male menopause is a physical condition similar to that suffered by women and likewise brought on by changing hormone levels, in particular of the key male hormone testosterone. A decline in testosterone levels affects bone, joint, muscle, arteries, and veins, and almost every major organ system because they all require testosterone to maintain optimum function. The most common sexual symptoms of male menopause include reduced interest in sex, increased anxiety and fear about losing sexual potency, impotence and other sexual dysfunction problems. These changes affect all aspects of man's life. Male menopause is thus a physical condition with psychological, interpersonal, societal and spiritual dimensions. In addition, benign prostatic hyperplasia and prostatic cancer also often arise at an advanced age. Infertility. Infertility is the failure of a couple to become pregnant after 1 year of regular unprotected intercourse. About a third of infertility problems are due to female infertility and another third are due to male infertility. In the remaining cases, infertility affects both partners or the cause is unclear. More than 90% of male infertility cases are due to low sperm counts, poor sperm quality or both. The remaining cases of male infertility can be caused by a number of factors including anatomical problems, hormonal imbalances and genetic defects. Sperm abnormalities. Sperm abnormalities are categorized by whether they affect sperm count, sperm movement or sperm shape. They include azoospermia, that is complete absence of sperm cells in the ejaculate, oligospermia, that is low sperm count, asthenospermia, that is poor sperm motility, and teratospermia, that is abnormal sperm morphology. Morphology refers to shape and structure. Abnormally shaped sperm cannot fertilize an egg. About 60% of the sperm should be normal in size and shape for adequate fertility. The perfect sperm structure is an oval head and long tail. Retrograde ejaculation. Retrograde ejaculation occurs when semen enters the bladder instead of emerging through the penis during orgasm. Varicocele. A varicocele is an enlargement of the internal spermatic veins that drain blood from the testicle to the abdomen, that is back to the heart, and are present in 50% of the general male population and 40% of infertile man. A varicocele develops when the one-way valves in these spermatic veins are damaged, causing an abnormal backflow of blood from the abdomen into the scrotum, creating a hostile environment for sperm development. Varicoceles may cause reduced sperm count and abnormal sperm morphology, which cause infertility. Structural abnormalities. Any structural abnormalities that damage or block the testes, tubes or other reproductive structures can have a profound effect on fertility. Cryptorchidism. Failure of descent of one or both of the testes into the scrotum. The testes first develop within the abdomen before birth and then normally descend into the scrotum. Hypospadias. This is a birth defect in which the urinary opening is on the underside of the penis, can prevent sperm from reaching the cervix if not surgically corrected. Blockage in the tubes that transport sperm. A genetic or developmental mistake may block or cause the absence of one or both tubes, which transport the sperm from the testis to the penis. Low semen level in ejaculate may be associated with structural abnormalities in the tubes transporting the sperm. Hormonal deficiencies. A small percentage of male infertility is caused by hormonal problems. Hypogonadism is the general name for severe deficiency in gonadotropin releasing hormone GnRH. GnRH stimulates the hormonal pathway that causes testosterone synthesis and sperm production. A disruption in GnRH release leads to a lack of testosterone and a cessation in sperm production. Hypogonadism is most often present at the time of birth, or it can develop later in life from injury or infection. Kallmann syndrome or panhypopituitarism in which the pituitary gland fails to make almost all hormones. It can also develop later in life from brain or pituitary gland tumors or as a result of radiation treatments. Other hormonal disorders which can disrupt male infertility include hyperprolactinemia, hypothyroidism, congenital adrenal hyperplasia. Genetic disorders. Certain inherited disorders can impair fertility. Examples include cystic fibrosis, polycystic kidney disease, Klinefelter syndrome, Cartagner syndrome. Cystic fibrosis can cause missing or obstructed vas deferens, the tubes that carry sperm. Polycystic kidney disease, a relatively common genetic disorder that causes large cysts to form on the kidneys and other organs during adulthood, may cause infertility as the first symptom if cysts develop in the reproductive tract. Klinefelter syndrome is marked by 2 X and 1 Y chromosomes. The norm is 1 X and 1 Y, which leads to the destruction of the lining of the seminiferous tubules in the testicles during puberty, although most other male physical attributes are unimpaired. Cartagner syndrome, a rare disorder that is associated with a reversed position of the major organs, also causes impaired sperm motility. Testing for male infertility. Testing for male infertility can be complicated, time consuming and expensive, because the end results of the many disparate problems that cause male infertility are low sperm count, abnormal sperm shape and poor sperm motility. Additional tests besides a semen analysis are required to pinpoint the cause of the infertility. The evaluation of the male begins with a history, physical examination and 2 semen analysis. Other tests includes hormone evaluation, semen culture, biochemical analysis of semen, post-coital or cervical mucus test, sperm penetration assay, that is hamster's test. A thorough physical examination and history can diagnose physical problems such as varicocele, Klinefelter syndromes, retrograde ejaculation, erectile dysfunction and premature ejaculation. An absence of sperm in the semen sample is indicative of ejaculatory incompetence, retrograde ejaculation or one of the conditions that block the spermatic ducts. Treatment. Treatment for infertility should first address any underlying medical condition that may be contributing to fertility problems. Drug therapy may be used to treat hypogonadism and other hormonally related conditions. Surgery is used to repair varicoceles and correct any obstructions in the reproductive tract. If fertility issues remain unresolved, intrauterine insemination, also called artificial insemination, and assisted reproductive technologies such as in vitro fertilization should be considered. If fertility issues remain unresolved, intrauterine insemination, also called artificial insemination, and assisted reproductive technologies such as in vitro fertilization should be considered. Intracytoplasmic sperm injection is commonly used in combination with in vitro fertilization in cases of male factor infertility.
In this lecture, we have covered the types of reproduction, that is sexual and asexual. Sexual reproduction helps to introduce genetic variation into species which can be beneficial in the long run. It also explored male reproductive system, temperature control of testes, process of spermatogenesis, functions of accessory reproductive glands, andropause, and the causes, diagnosis and treatment of male infertility.